morning, everyone. I'm Osama.
And I'm Huda. And today we're going to be teaching you how to take blood pressure manually. So in all healthcare professions and fields, healthcare professionals don't always have access to a automatic blood pressure cuff. So it's important to always know how to take blood pressure manually as well.
One of the pieces of equipment required in taking manual blood pressure is a stethoscope, which is important to listen to the pulse in the artery. This is an earpiece which is used to listen to the pulse. This is the tunable diaphragm, which is used in teens and older, and then this is also the bell, which is used for infants.
The next piece of equipment that is required to take manual blood pressure is the blood pressure cuff, which consists of the cuff itself, the bulb, the adjustable valve, and the sphygmomanometer. It is important to make sure that the cuff itself is the proper size for the patient, which is easy to detect on this one due to the diagrams that are provided.
Hi, my name is Samia, and today I'll be a patient for blood measurement. And it's important to be letting your patient become more calm, just because if they're experiencing white coat syndrome, this makes the testing a little less accurate.
So it is important to allow them to sit down for a couple minutes, rest, remain calm, let their nerves cool down, just so their blood pressure measurement and it becomes more.
The first step in taking blood pressure is wrapping the cuff around the patient's arm. So you want the patient to be sitting comfortably, resting their arm at the level of their heart. Then you want to take the cuff and ensure that it is the proper size for the patient. You want to be able to place approximately 2 fingers width above the crease of the patient's elbow where the brachial artery is going to be located. To ensure the size is correct, the healthcare professional should be able to easily place 2 fingers under the blood pressure cuff where the stethoscope is going to be placed. There is an arrow that is usually located on the cuff to guide you as to where the blood pressure cuff must be placed. You will know that it is properly placed when the arrow or the sphygmomanometer line is right above the elbow crease. You will then take your stethoscope and use the diaphragm to listen to the patient's pulse. You will place the diaphragm right on the brachial artery and place your thumb above the bell. Next, you will begin to inflate the bulb while listening with the stethoscope until you reach 180 mmHg on the sphygmomanometer. These numbers are measured in millimeters per mercury. This will be the systolic number of the patient's blood pressure. You will start to slowly release the cuff using the adjustable valve until you can no longer hear the patient's pulse anymore. Record this number, as this will be the diastolic number. The number is measured as a fraction with your systolic over the diastolic number in millimeters per mercury. The normal measurement of blood pressure is 120 over 80 millimeters per mercury, but can vary based on numerous factors such as the patient's age, weight, and lifestyle. The healthcare professional will then record this number for future reference and to determine whether the patient may be experiencing hypertension, meaning an increased blood pressure, or hypotension, a decreased blood pressure. Essentially, blood pressure determines the force of blood rushing through the arteries. Okay, so overall, when taking blood pressure, it is important to remember these quick tips. Make sure the blood pressure cuff is the proper size. Remember the 2-finger rule so that you are able to fit 2 fingers between the cuff and the patient's arm.
So ensure that the patient is at a resting heart rate so that they are calm, relaxed, and have achieved their normal heart rate so that your blood pressure reading is more accurate.
Also make sure that you have placed the blood pressure cuff on the patient properly and the 2-finger width above the crease of their elbow to help increase with the accuracy of the blood pressure.
And lastly, make sure that you watch for when you begin to slowly release the adjustable valve when you are taking the blood pressure. When you first start hearing that heartbeat, that is going to be your systolic number, and then you slowly release the valve until you no longer can hear the patient's heartbeat, and that will be your diastolic number.